Hey there, my name is Dr. Seth Myers with Sinus Spine Support and Rehab. Today is actually Wednesday, but I'm bringing you our Tuesday tip of the week video. This week we're talking about imaging for low back pain, when you should and shouldn't do it, because low back pain is super common, one of the most common things that I see in my office, and so that leads to obviously lots of questions about when I should get an image. So let's dive right into it. So by and large, the vast majority of the guidelines in today's world tell us that there's kind of three big things we should be looking out for imaging in terms of when we should get it. And that is if maybe we've got a history of cancer, maybe there's a risk of infection, or there might be a fracture. With that fracture, obviously that includes usually some trauma, right? So history of cancer, potential for infection, so maybe a fever or recent procedure done, and then obviously fracture, some sort of trauma. Those big three is kind of what we're trying to screen for, and those would absolutely recommend trying to get some imaging done to rule these in or out right away. So outside of that though, kind of the next thing that we might be concerned about for imaging would be if we think there's some nerve involvement. So if we get some numbness, tingling, or especially some muscle weakness down the leg, where we think a nerve is being compressed, but especially if we look like we're going to have a surgical intervention, that's when we might say, okay, for nerve irritation or nerve involvement, imaging would be recommended. But even still, in the early days of someone dealing with even leg-oriented symptoms, imaging might not necessarily be helpful. But again, outside of these big things, the vast majority of the time, imaging is actually not usually recommended. Most common low back pain, imaging is not super helpful, and there's two big reasons why. Number one, which I've talked about this before, is most changes that we're going to see on either an x-ray or an MRI are totally normal changes, just like our hair changes color, just like we get some extra wrinkles in our skin. The same thing happens on the inside of our body, and those aren't painful. So those changes are normal things that happen, and they don't have to be pain generating, and oftentimes they aren't pain generating. And that's kind of this last point, is just because we see weird changes or just because we take a picture, that doesn't always show us where the pain is. Tons of studies where folks have had disc bulges, disc herniations, and very little or even no pain at all. And then the inverse is true. We have lots of cases where folks have tons of pain, high levels of pain. You take an X-ray or MRI and we don't really see anything wrong with them, or it's very hard to find anything specific we can pinpoint as being the pain generator. So imaging, especially in the first few weeks of dealing with your common low back pain that isn't one of these three things here, is usually not recommended. And then the last thing that I'm going to say, there are two more big reasons why we generally recommend not shooting for imaging. Number one is it costs money. So if you're getting an x-ray, but especially an MRI, that is money out of the patient's pocket. And so you could have been using those dollars to start getting some treatment. And then number two, that's time, right? So if you go to a provider and they recommend you get an image, you're spending that time, whether it's days or even weeks, to get that image before getting in for some actual treatment. And so those other two big reasons right there are more reasons why we generally recommend not getting the image right away and just kind of going towards a rehab active care approach for low back pain. So again, just kind of a take-home message. If you're dealing with low back pain, I would strongly recommend you see a provider. But most of the time, when we're dealing with that low back pain, we don't need an image to have a really good game plan, as long as there's a good history and exam that's been done. And anyway, I hope this video is very helpful. Hope you learned something from this. If you got any questions about this, I'd love it for you to hit me up. And thanks for watching.